issue as such, but I have highlighted my other concerns regarding my face and all. They were noted down. So this is not the only thing. The other thing is the beard, which I have mentioned that I want to get the beard picture here. I was having the consultation earlier, so it was realized that it would be better if I can lower down this portion to have a more proportionate face.
Correct.
So that also is a possibility I'm open to.
But if you want me to do that, then it will be a by job. Then there is a different planning we have to do. See, for rhinoplasty, what happens? I take a diagnostic scan, then I see what's happening, and then we go at the surgery.
Yeah.
But for a jaw surgery, it's slightly different. Then we have to do another scans, then do the planning, kitna aage aana hai, how much of clockwise or whatever rotation, then do a morphing, then do a splinting, then do surgery. So we take a couple of days for that thing to happen. That's the first thing to understand.
Okay.
Then the second thing is, in your case, it might be difficult to do both that and the nose perfectly. Like if I do the nose, I can do like 100%. If I do that and the nose might be only 85-90%.
Why is that so?
Because see, we're going to be working on the nasal base here when we do the jaw surgery.
Okay.
So therefore, I won't be able to work in the full extent if I do the nose on top of that. If I do the jaw, because see the nose rests on the upper jaw. So if I move the upper jaw forwards and rotate it and all that, so it's like moving the foundation of the nose, at least part of the foundation, and then therefore that hinders me from performing a full-blown, as I call it, nose job or rhinoplasty. It's still doable in a lot of patients, but you have to understand that it cannot be a full-blown, a total nose job. So that's one more thing. With regards to your facial balance, yes, I do agree that your face, everything is small, your airway is small. Do you have snoring by any chance?
I don't know. I can't say for myself, but I don't know. Somebody else has not pointed me out.
Then you don't have. Okay, fine. And do you have anything like daytime sleepiness or less energy? ऐसा कुछ महसूस करते हो? Nothing like that,
I'm
right?
a special forces guy. I don't have much.
Nothing. Then don't do that. If that is the case, then you might just want to get the nose done and then wait for a while and see if you want to
So
get
my
anything.
problem is that I don't get leave. That's the only problem. That this is something which I have been planning for more than a year or so. And then I've gotten this particular period where I've gotten leave, and then again I'll not be
Getting leave.
Yeah. So that's a major issue for me.
So you would want to try and get done as much as possible in one
Yeah.
go. But I would think you still go only with the nose. And then you wait for a year. And then if you think you can go ahead. Why I'm saying this is also because I think the, what shall I say, the impact it will have on your face will be remarkable. You might just be satisfied. You might say, "Okay, that's enough."
Okay, that's it. That's a good point. That's a very
If
good
you
point.
think so,
That's a very good point. I agree with that. So now how did this discussion came into being? I'll let you know what happened first. Now I've gotten these implants.
I can see that, yeah.
So the reason why I got these implants done was because I had an accident way back in 2010 or so somewhere, and in that accident my jaw had come forward, the front teeth had come out. Also coupled with the tongue pressure, I have a longer tongue, so it gives external pressure. So there was an orthodontics treatment tried, it failed. Then we went in for again. I had a discussion with the dentist now. So we tried that we'll scrape down the teeth and then we'll put crown in it. So we tried the crown treatment, but because of the tongue pressure, the teeth further came up after about
So then
couple of
you
years.
lost that and then eventually...
So then I went for the implants. Now the problem with the implants is I wanted a specific shape. This is what I wanted was now presently the upper teeth are like this. You can see there's
Yeah,
a
I can see
gap.
that, yeah.
There's a gap.
Correct.
My lower teeth sit like this. I wanted this to be further in. My actual mouth position should be something like this.
Correct.
But it is in because of this teeth.
It's
Because
like a
this is
deep
not
bite. We
forward.
call this deep bite.
Yeah, deep bite.
I think they would have done it intentionally so that the life of these teeth
Because
are
of
more...
the safety factor there.
Ah.
So the discussion was this exactly. So what happened was because of this leave and all issue, I get very little time. So I had only a week or so to fix this. So when they took my impression for the after the surgery for the implants, they took my impression for the crowns. Then the mucosa had not fully healed. So because of that, the mucosa later contracted, and now I have a gap.
Oh,
I have a gap,
where is it? Oh, yeah, correct.
both upper and lower.
But that we can rectify very easily.
So the thing was that what I wanted was that if the crowns are to be replaced,
Yeah.
then I wanted this problem to be solved. The safety
But,
factor, that's exactly what was the point when the doctor told
See,
me.
that is something that I won't decide, and I think for that, see, that's not a surgical thing. This is a mechanical thing you're saying. This is not a surgical thing. This is a mechanical point.
Yeah.
What happens is, if you sometimes get the way you're asking, the life of these teeth may not be long. And life of the implant also can get compromised.
I understand. I agree fully to it. But the point is, the very reason for getting
Correct.
the treatment done is not solved.
That I agree.
That's the whole issue of why I went in for the treatment is.
Okay, I'll do one thing. We have an expert doctor with
Yeah.
us. Let her have a look at it. If
Yeah.
she thinks it's feasible, we'll go ahead. I'm not going to stick my neck and say it is feasible.
Yeah.
If she thinks that, see, because we're looking at long-term success of these implants that bear the teeth. If you do not put the suprastructure properly and give false forces regularly onto the
I
implant,
agree.
they will fail,
I agree.
which is a disaster.
So my point is that there can be a bias. There can be a compromise.
I get
in
your
it,
point.
wherein-
We'll look if that's
Yeah.
possibility,
Yeah.
and definitely the gap we can solve. That is just a few days job. They'll take it out. That is 100% doable. I
Yeah,
know.
that I know.
Yeah.
Again,
But you want to get
when
them
I-
together.
Yeah.
If at all. I get your point. Seri, இவங்கள சாராட்ட அனுப்பணும். What we'll do is, you can talk to my dentist. I'll explain to her. You explain to her. Then let's see what she can do.
Yeah.
And if you think if she can do it, we'll touch your teeth or we'll let it remain.
Okay.
That's good, right?
That's good.
Okay.
That's good. And about the beard transplant. This was
Beard we can do. It's easy. We can do
right now. I have covered it. I use a hairspray and I dye it.
that is possible whenever you want, wherever you want. 2, 3, or 4, 5 days after your nose surgery, we can do your beard. That is easy.
So what will be the plan?
So the plan is we can do the nose today. Before we start you for the nose, you'll get a blood and see the anesthesiologist, and you'll see our dentist. She will tell you about this.
Okay.
If this is a possibility, then they might start some work on that. If it's not a possibility, we'll let that be. We'll do your nose alone.
Okay.
4 days or 3 days or 5 days, depending on when you're comfortable, we'll do your beard. Beard will be done under local anesthesia, no general anesthesia. You'll be conscious. They'll take follicles in the back, only the follicles, no scars, and we'll plant it wherever you desire. Straightforward.
Okay.
Teeth, if you do want, they will remove it. They will take further impressions. They do further planning and deliver it to you within a week if they plan to do that.
Okay.
Nose, you'll need to stay with us for 12 days. 12th day, we'll remove the splint. Total recovery might be up to 20-25 days. We might also harvest rib. I might be able to manage without as well. Because of your DNS, I might have to harvest, if at all. Otherwise, there's enough cartilage for me to work with that. Also, I have to decide how much of cartilage I need there to augment the radix, so that this is too depressive and is sharp. So we will raise that and reduce here. So that is a plus or minus the rib.
Okay.
சாரதா சொல்றேன்.
So the thing is that if I may use a pen or something.
Sure. So write something.
Actually, what I wanted was. This is the general purpose. Now, if you see this point, these 2 points are raised higher than this point. This is what I want.
Okay.
The sharp point, and what normally happens is, now this is something which I want. This is the general.
If you have a picture also of another person's nose that you like, that will also help me. I got your point, but still,
Yeah.
this will be what we're going to do. You're just asking for a very standard
Yeah.
nose. That's fine. That will be done. And how many days leave do you have, sir? Can I know?
I have planned for my return for 26th of July.
Okay, that's good.
About 12, 13 odd days. This is as per the discussion we
Sure.
had earlier.
Yeah, that's fine. No, just to reconfirm.
Yeah. No, I can extend this stay.
No need. This will be enough, I think.
I can extend this stay for about. My son's birthday is on 1st of August.
You should
I
be
want
back
to
by
reach
then.
over there, so that's the idea.
That'll happen.
Not like this.
Okay, done. I get it. So this is so you see the thing is this point is really in. So this is really out.
Yeah.
So that imbalance when you settle, it'll automatically get to be that shape. Also, this is sunken, this is come up, so therefore it looks like the nose is too long, over protruded, and covering most of your lip.
Yeah.
We can correct all of that. But I'm not going to give you a small nose because a good strong nose suits you.
Yeah, fine.
So we will do that only. But only thing will make it more proportional and the bulbosity and see the lip only like hardly 2-3 mm is visible now. So we can make that normal, and when we increase the height here, so the nose will then look more proportional. When you reduce here and increase
The
that.
point, what I'm trying to make is that if you just raise the tip,
Yeah.
if you don't touch it, now from the sides, what happens is this becomes lower.
Yeah.
I don't want that.
Correct. You want that
I
higher.
want this also to be raised,
Correct.
so that the natural shape is maintained.
That will happen if you only do this. What you're saying will happen. But if you work on the whole nose, that will not happen. I'll do that. Don't worry. That is what we're going to do anyways. That will only suit your face also. There's a look